Bwindi is tucked deep in the western Ugandan district of Kanungu. Despite its tourism potential backed by the Bwindi impenetrable forest, the folk here live a laid-back life, with one of their main challenges being the lack of access to quality health care. In response to the health needs of the community, especially the Batwa minority group who were driven out of the forest that had been their habitat for so many years, the Church of Uganda, with funding from well-wishers, started a health facility that has since grown into the Bwindi Community Hospital. 3.5 years ago, the hospital started a community health insurance scheme to help locals access better and affordable health care.
Our first aim was to sensitize the people about their health rights, their health needs, such that they have that willingness to pay because they know what they are paying for.
In the 90s, when the AIDS scourge hit hard and many people were dying, the locals here had started to pool funds to help with burial arrangements.
We collect funds and then that fund be kept, then others be borrowed, so that when a person gets a problem, he can use it and solve the problem.
The hospital developed the health insurance scheme through partnerships with these Batakatwe now called Batakatwe Tambire groups.
But we have been working with these groups to change their perception and their practices as far as health is concerned, such that instead of pulling their resources together to bury someone who has died, they can pull these resources together to ensure that everyone can access top quality services.
Now community members, when they get sick, they go there and they get treated at a low price.
In this Equality Health Bwindi scheme arrangement, each person pays an annual premium of 10,200 shillings and 2,000 shillings each time they visit a doctor.
That is not so prohibitive, but it is also to prevent people from misusing the service that, when you sneeze, you run there. The package includes surgery, dental services, most of the services you can imagine that are offered in a hospital, but it excludes other community health interventions like health education.
Sarah Saturday is one of the locals on this program. She has brought her son to the hospital for treatment. Saturday is able to access all the treatment for her son after paying only 2,000 shillings. This mother is one of the 25,000 people who are currently enrolled on the Equality Health Bwindi scheme. This hospital serves an estimated population of over 100,000 people in 3 sub-counties.
Yes, they contribute their money. Now that, brings in a sense of ownership, and therefore they want to know what services they are getting, what quality.
As much as this may seem affordable, majority of the locals, especially those who are most in need of the health care, cannot afford it.
Those families they think are very poor, they can't even afford 2 meals a day. And for those ones, they have to pay half the premium.
Currently, Uganda does not have a national health insurance plan. Now that means that such community-based insurance covers could help the peasants, who are actually the majority of Uganda's population, access better health services. Gertrude Tumusime with Kwade, NTV, Bwindi.